Well, hi everybody. I'm here today with two of our chief PAs, and we want to talk to you a little bit about what it means to be a PA at New-York-Presbyterian. So first, this is Suze Wollard and Daryl Blackstock. Suze, let's start with you. Why don't you tell everybody where in the institution that you work?
So I work in neuroscience. I work for the Department of Neurosurgery and Neurology, and we have PAs in neurosurgery, in neurology, and in the neuro ICU at the Weill Cornell campus.
Terrific. How many PAs do we have overall at New-York-Presbyterian?
There are over 500 PAs now.
That's amazing. I remember when we had just a couple of dozen PAs, and we've grown tremendously. So Daryl, tell everybody where you work.
So I work in the Department of Transplant Services here at Columbia University, and we have close to 35 PAs covering all solid organ transplants here on the campus.
Wow. Daryl, explain to everybody a little bit about the educational program that qualifies you to be a PA.
So typically, before entering the PA program, which is usually a master's level program, you have your bachelor's. It consists of a year to a year and a half of didactic or coursework, and then after that is followed by clinical rotations. And after that, you graduate with your master's and you sit for the certification, national certification exam.
Great. Suze, describe a little bit about the scope of practice that PAs have.
So PAs can practice medicine. They can be first assistants in surgery. At New-York-Presbyterian, PAs function in different roles across all different specialties. They can do a history and physical. They can order tests. They are the primary person managing the patient care. They speak to the patients about the results. They prescribe medications. They discharge patients from the hospital. They're first assistants in surgery, and they spend a lot of time training medical interns and residents as well.
So clearly very important members of the healthcare team. Now we have, as you said, PAs that really go across the organization in virtually every one of our specialties. We also have something called a PA-run service. Daryl, why don't you explain that?
So a PA-run service differs from the other services in that we don't have interns or residents covering those patients. And the PAs really serve as the primary frontline provider, managing the majority of the care, and we partner with our physician and surgeon colleagues to wrap up or deliver the care. And of course we partner with our nursing, and I just can't begin to talk about all the other services that we partner with, physical therapy, nutrition, pharmacy. Yeah. But the PA really is the primary frontline provider on those services.
Great. Suze, you started to tell me a little bit before that PAs also get involved in research.
So because we're the frontline providers, we may be providing care for a patient, and we may start to see a pattern in outcomes or something that we're curious about. For example, with the opioid crisis that's going on nationally, the Department of Neurosurgery decided to step back and reevaluate how we're prescribing narcotics. And so we worked with our anesthesia team and our neurosurgeons and our PAs, and we came up with a different model to help lessen the amount of narcotic use that we're prescribing. And then one of our PAs came up with an idea of, well, let's see how effective it is. So now we're going to apply for an IRB and see if we're really impacting patients the way we're hoping to, where we're really controlling their pain, and we can get that information from them and see how well we're doing with the changes to our clinical practice. So sometimes PAs are, since they're frontline, it'll spark an idea, and then that can lead to something more in the research field.
Terrific. Daryl, how about from the quality perspective? We've got a lot of PAs working on that.
Oh, we do. So our quality department here, its staff, their leadership, quite a few PAs are in that department and working with the clinical areas to improve the quality of care that we deliver. In addition to that, we have a lot of clinical quality initiatives that the frontline PAs were involved in, just, again, overall improving the care that we deliver.
Suze, as you're telling everybody about being a PA here at New-York-Presbyterian, what's something that you'd like to emphasize?
I think a really important part of the PAs here at NYP and some of the great work that they do is in the small things. They really are attentive to the details. They are the ones who go through and make sure the medication reconciliations are done properly every time. They're the ones who go through the discharge summaries and make sure that we're providing accurate and thorough information to the next provider who's going to care for that patient. And I think just that those small attentions to detail make a big difference in the patient's outcome. And I think the PAs are really integral in that role.
It's the small things that make up so much of the care that we deliver. Daryl, as we're wrapping up, tell everybody how you feel about this type of job, and has this been a great career for you?
Oh, it's been a great career. The PA profession is excellent. I'm glad I made this decision. It's just been wonderful.
Good. I want to thank both of you. You're very important to the care that's being delivered. And really, thank you to all of our PAs throughout this organization. New-York-Presbyterian, I think it's fair to say, could not function without the great work that our PAs are doing in so many different ways every single day. As you heard from Suze and Daryl, it is a wonderful career. And so if it's something that you might be thinking about, please talk to one of our PA colleagues or to our HR team to get more information about how you might pursue this career. Thank you.